And welcome back to the Wellness Paradox podcast. I'm so grateful that you can join us on this journey towards greater human flourishing. As always, I'm your host, Michael Stack, an exercise physiologist by training and a health entrepreneur and a health educator by trade. And I'm fascinated by a phenomena that I call the wellness paradox. This paradox, as I view it, is the trust, communication, and interaction gap between our fitness and wellness professionals and our medical and allied health professionals. This podcast is all about closing off that gap by disseminating the latest, most evidence-based, and most engaging information in the health sciences. And to do that, in episode 31, we're joined by Clay Summers, who's the executive director of mParks. Now, when you hear me say parks, I'm referring to parks and recreation departments. And this will be an interesting discussion about the collaborative opportunities that exist between our respective industries. Certainly, we've seen the importance that parks have played during this COVID period, where many of us couldn't go very many places to be active and exercise in the early parts of the pandemic. But more than that, I think it's important that we realize that parks and rec departments and the health and fitness industry, we have similar goals. Our goals are to make our communities healthier and happier and lead lives that are more oriented towards flourishing and away from languishing, which is what we've dealt with throughout the majority of this pandemic. We have resources as an industry that Parks and Rec do not have. Parks and Rec have resources that we don't have as an industry. And the opportunity to collaborate is key to overall population health in our communities. And that's what this discussion is going to focus on. Any additional information we'd like to share from this episode can be found on the show notes page by going to wellnessparadoxpod.com/episode 31. Please enjoy this conversation with Clay Summers. Today, we're delighted to be joined by Clay Summers. Clay, thank you so much for joining us.
Absolutely. Happy to be here, Mike. Appreciate the invite.
We're going to get into a really interesting discussion today around the collaboration that can exist between parks and rec departments and the health and fitness industry. But before we dive into that, I think it would be helpful for our audience, Clay, to understand a little bit about your background.
Yeah, absolutely. And where I kind of come from and come at this has been for 20 some years as a practitioner in the parks and recreation field, Mike, honestly, and worked in different communities throughout the Michigan area as a recreation kind of provider and programmer in communities, providing those athletic leagues and those sports opportunities for both youth and adults, collaborating with community members and other organizations to bring, whatever that community might need from a recreational standpoint as far as events and leagues, and have slowly moved my career through that into becoming a director of a couple of different community parks and recreation departments. So a little higher broad level base there, land development, actually in the parks world, putting together master planning and how the community that I represent is going to develop a park system or continue to develop, and then have staff that were the folks that were doing that programming and those types of things. So spent about 20 years in the field doing that in different areas, and then served on the board of directors for our state association, mParks, which is the Michigan Recreation and Park Association. Served on that board for about 4 years. And that's where I really got the passion for the association work. And lo and behold, our executive director at the time decided it was time for her to retire and hang up the association pin. And so threw my hat in the ring, and lo and behold, 4 years ago, they hired me as the director. And so now here I am as the director of our state association. And yeah, it's been a good run. And we're happy to, be kind of the advocacy arm for the public facing parks and recreation agencies around the state, as well as the educational kind of provider for those folks, giving them the opportunity to learn both from their peers and in conference style settings. So that's a quick kind of background for me.
Awesome. And I love how you came up as a practitioner in the system. I think it's so essential when leaders have been through almost every step of the process. You know what it was like on the ground level, and you've worked your way up to this, very, very high level in the park and rec world. And I think that allows you to connect with your constituents in a much more practical and pragmatic way, which is awesome. Before we get into this collaborative effort that can exist between health and wellness and fitness clubs and parks and rec, I think it's important for you just to level set for everyone on what parks and rec departments actually do. Because even as I sit here in Clay, we've had many conversations in the past. I don't know if I know everything that falls under the purview of parks and rec. And I think that that's a really important level setting place to start.
Yeah, no, that's a great question, and one that we like to talk about, because I don't think a lot of people do understand the level to which the folks that are working in the field actually provide services for their community and build a place where people want to live, work, and play, kind of that whole scope, Mike. And that's something that we're all pretty proud of, as the folks that I represent are all civil servants working. And I think people give us a hard time sometimes. Oh, you work for a city, you work, how's that going? You get all this time off, you get, tax dollars that are funding you. It must be nice. And it's quite the contrary. Many of our parks departments are very much and on record underfunded from a general fund standpoint. So a lot of it is enterprise funding, doing things that provide revenues that offset the direct expense that department may incur. So our folks do a lot of stuff. They do everything from park maintenance and park cleanup, trash pickup, bathroom cleaning, general construction projects, as far as things that are within the purview of the staff, to providing a vision for the programming aspect and listening to what that community might want and need. Some communities want a 4th of July holiday program. Some communities don't. So we really wear a lot of hats. And as well as I do, currently in the situation of being understaffed, folks are wearing a lot of hats, and they're being asked to do things outside of what they generally were hired to do. And so we do feel like we're a pretty resilient bunch, but it's really, when it comes down to the meat of it, it's really creating a feeling within your community and being that driving force behind placemaking and the economic development and the real estate and the schools and all those things come into making a place, but having lands and trails and parks and a system put in place that's well organized is as important to a community making that place as any other component. We like to say, we love our police and fire, right? We all love our police and fire, but I don't know anybody that calls up a realtor and says, how's your police and fire department? I'm considering moving to X community.
Yeah.
Right. They will say, how's your school district? What's the housing market look like? What types of amenities do you have that me and my family can become involved in? What's the business pulse? What things do I have? So I think we play a very strong role in attracting talent and bringing folks in. And that's nothing any of us learned in school, in a curriculum-based setting. You come into this thinking, I'm going to run a program. They taught me how to run a program. I'm going to design a park. They taught me how to design a park. But nobody understands the fact that we've learned on the job how to create communities in a place, in a sense of place. And so I think that is a 30,000 foot level that I think some people don't understand that our folks have a challenge to provide.
Yeah. And thank you for that, because I think it's so critical. And I'm happy to hear you bring up the economic element, because it is a significant value add in a community to have an extensive parks and rec system. And you're absolutely right. Fire and police are very important, and we're not disputing that, but no one does call up their realtor and say, hey, tell me about the fire department. The one thing that I find intriguing. And I've read a couple of pieces on this as of late, and I think this will bring us into our discussion for today, is that there's a lot of research that suggests that built environment, parks and rec, a trail system, communities that have that more extensively developed are more physically active communities. That's been established in a significant amount of public health and epidemiological research. With that said, it seems like the parks and rec space and industry and the health and fitness industry, we have similar goals to make our communities more active, to help our communities come together in different environments to improve their overall health and well-being. How do you view the similarities between the health and fitness industry and the parks and rec industry?
Yeah, I think you hit it right there. As I mean, the similar goals are we really want to affect the well-being of the community in which we serve, and you choose to put a health facility or gym in a community because you have a passion for that area or that community, and you want to bring something there, right? And I think from the Parks and Rec standpoint, this is the opportunity, but this has also been the roadblock over the years. Is the opportunity is to collaborate with like-minded individuals, but it's also been viewed as a competition, for clients. And so I think really the similarities come to the fact that overall we want to make our communities as healthy and as desirable as we possibly can. So I think we come at it from the approach of wanting to make the community desirable to live, work, and play. And I think that has a health, there's a reason for Parks and Rec to provide healthy activities. And then from the standpoint of maybe more where you're coming from, it's really the health-driven outcome. It's we want healthy people. Okay, we want healthy people. And if I'm going to have a business here, I want my folks as healthy as they can. And yes, that's the entrepreneurial goal there, is to bring people into a facility with the mind of, we can make you more healthy if you come here. And I think we look at it from the holistic approach of the community as a whole. We can attract young talent and people to this area if we have X, Y, and Z in place. And the biggest challenge for us, Mike, as a state, is you look at states like Colorado and Wyoming and Utah, and people are leaving to go there because the perception is they're healthy states. Mm-hmm. There's a lot going on. There's a lot of trail systems. There's a lot of wide open space to hike and do those things. And Michigan, as a resource state, is positioned as well, if not better, than some of those states, mm-hmm. From the attributes that we have. And so I think it's breaking down the barrier and saying we don't always have to be in competition. Like, what do we do that can enhance, the community and enhance the health of the individuals living there?
Yeah, I'm curious what you just said there about Michigan from a physical resource standpoint being just as well positioned, if not better positioned, than some of these other states that are traditionally viewed as healthier places to live, work, and play. Why do you think that's the case? Why do you think that we're not maybe leveraging these resources from at least a public relations standpoint, like some of these other states are?
Yeah, so we've started to do that, but we're behind, in my honest opinion. And Michigan is known as the trail state. We've got more trail systems developed in the state of Michigan than any other state in the United States. So we're walkable. We need to do a good job of promoting that. Our Pure Michigan brand has certainly appealed to the tourism industry, mm-hmm. right? And bringing people into Michigan to visit lakeshore communities and those things. But we need to kind of also promote some of those assets outside of, our Great Lakes. Don't get me wrong. They're extremely important to bringing people to Michigan. But we really, for the first time ever here 2 years ago, our governor created the Office of Outdoor Industry within the Department of Natural Resources, which is to help, see if I can explain this well, to help kind of highlight the industry that is outdoor recreation. So not only myself as a parks user, but the folks that are selling the backpacks and the kayaks and the bikes, and and those folks as partners in this. So we've started to promote that, And we're one of 13 states that have an office like that in our state government. So that's pretty exciting. But there's always more that we can do. I mean, we really have, we have 103 state parks in this state. It's unheard of for a state our size. I mean, most states, and I'm throwing out generalities, will have 50 to 60 state parks throughout their system. We've got 103. So we really look at our natural resources as a something that we should applaud and all be able to enjoy.
Yeah. And I think what's interesting, and we'll get into this as the conversation goes on, is you can't do this by yourself. I think if there's one thing we've learned throughout the course of this pandemic with regard to public physical and mental health, because not to go down the rabbit hole, but mental health is a big part of this discussion, because being outdoors, we know from just volumes of evidence it improves mental health. This has to be a collaborative effort. Now, despite us talking about collaboration here, there hasn't been much collaboration in the past. You mentioned this view of competition being a barrier to our collaboration. Is it just that simple that we're viewing this as purely we're competitive entities, or is it more nuanced than that?
Again, another great question. I would say that it has taken my folks on our end time to understand that we don't need to be everything to everybody as the government agency, right? We do not need to be the ones who provide every single service in the community. If it's being done, let's celebrate that and let's figure out how we leverage that. It's taken us time, because when I look back to when I started 23 years ago, I was expected to provide everything the community wanted because we were the city or we were the county, right? And so we didn't look beyond those borders, and we didn't look to say, what's being done. We just did what we wanted to do, and we didn't care. And that's a little harsh. I'm saying it a little bit harshly, but it's taken some time for us to understand that we can all play in the same sandbox and leverage all of the services in order to have a better community. And it's something that I think in my world, coming from the government world, because of funding and because of cutbacks and because of the recession in 2008 to 2012, it was a hard lesson. Like, we had to cut resources, and we needed to look to folks that were doing similar things to say, how can we collaborate to keep it in our community? We just can't offer it anymore. And so it was a hard lesson. But it's a good lesson because it's really expanded. I think I've said to you before, I think Parks and Rec were looked at, hey, let's roll the kickball out and the kids will come to the playground, right? And they'll just be there and they'll have fun. Well, kids don't do that anymore. Right. Kids don't know how to play as much as they used to, or when we were growing up. So I think it's really kind of changed the perspective of, if we do have a health club in our community that's doing really good stuff, let's embrace that, figure out how we can work together. Offer outdoor fitness classes in a park, offer, something in our small community center, because we don't have machines and things, but we do have a gymnasium. And maybe the gym in town only has, a storefront, but they'd like to expand into offering other classes. Well, let's partner on this rather than not have it at all. So competition, yes, but I think it was kind of the getting hit over the head kind of aha moment. We don't all have to do all of this. There are other resources in the community, and it's okay to let the public-private partnership blossom rather than try to stamp it out.
Yeah. And I've said this many times during the pandemic with our own industry, because as a health and fitness industry, we've always viewed the gym down the street as our mortal enemy. We're fighting over this very small subset of the population. But I think what we've learned during the pandemic is that our real mortal enemy that we're fighting is a sedentary lifestyle, is poor dietary habits, is sleeping issues. Those are the things that are the common enemies that we need to come together against. And you mentioned a couple of things very, very briefly there of opportunities for collaboration. But I think this is the real exciting part of this discussion, because you have such a unique vantage point on the Parks and Rec ecosystem in the state. And I want to make this part of the discussion almost tactical in some senses. Where are those opportunities for collaboration, and for the fitness and wellness professionals that are listening to this, have them being, individual practitioners or facility owners and operators? how should we start to consider the first steps towards collaboration with Parks and Rec departments?
Yeah, I think it's as simple, Mike, as reaching out and making an initial point of contact with a Parks and Recreation department, and doing it in a tactful way to say, we're not always sure what you have to offer. We know what we have. Could we have a conversation around what we're doing? Most parks and recs are viewing themselves, we are the landowners. We have these properties, we have these facilities and these entities. We want to maximize the amount of time that our residents are spending there. So there may be a collaborative approach there on, I've seen some communities do like a walk and talk with the doctor, so you're collaborating with a physician, you might be collaborating with a health club, and you're utilizing some trail space or some unique walking spaces within one of your parks to have walking groups do that type of program. That's not something that we traditionally would have done, right? Mm-hmm. Come walk on your own. That's what it's there for. But to put a walking program on in conjunction with, a health expert and a physician, those are great ways to kind of break the ice and just say, we're not looking at this as a revenue generator. It's to start to generate a relationship around the profession of health, the profession of Parks and Rec, and then obviously our physicians and getting those folks involved. And then that opens a door to other conversations. I mean, those are some of the ways our individuals in our field have started. So if someone's listening and said, I don't have an idea of what I would want to do, there's an idea. Like, let's do a walking program in a park and let's collaborate. How do we do that? Well, we make a point of contact. It's that simple. Like, you can Google your local Parks and Rec, find the contact or the director and say, hey, I am so-and-so. It's how you and I, got connected. Someone said, you two should talk. Lo and behold, the relationship blossoms and you have some synergy. So I think we're in a role now as agencies where we're not going to say, oh, that's so-and-so from the health club down the road, I'm deleting that email. I need to pick that phone up and call that number and say, hey, absolutely, let's have a conversation. That's the mindset from our folks now. You may run into a few folks who still have the old guard up, but there's a lot of work we could do together.
Yeah, I agree. We all have that same common cause that we're working towards. You mentioned it, but just to be clear, this is just as simple in your mind as looking on the city's website and saying, who's the director of Parks and Rec, and then sending an email or a phone call to that person to start the conversation. Like that is the point of contact, I guess, is what I'm asking.
I think so.
Yeah.
I think that's fair. Yeah. I mean, that's going to be the person who's going to open the door and say, yeah, either, the conversation needs to evolve around me and the person making contact, or I have a staff member who does some of our health programming. This would be a great conversation to have. Would you come into a Parks Commission meeting and speak, about some of your ideas? See, the other thing is most of our folks have Parks and Rec commissions. Mm-hmm. So they're not voting, they don't make policy at the county or city level, but they make recommendations to the county or city. And so that could be another kind of foot in the door. Could I come speak at a Parks Commission meeting about some ideas we have as a fitness industry, mm-hmm. And as a fitness or health provider in the community? Most directors would be happy to have someone come in and speak to their commission. Let's be honest, it fills some time and they don't have to always be on, right? And it shows a collaborative approach. And so our folks are being challenged to provide public-private partnerships, and those would be steps towards providing that.
Yeah. And there is, from our conversations, some precedent for trying to get people more physically active in parks. I remember you've told me about this program called Park RX, which is in some degree of utilization, probably underutilized, but just touch really quickly on Park RX, because I think it's a very, very cool initiative.
Yeah. So the Park RX program is a program that was developed by a physician, a pediatrician out of Washington, D.C. named Dr. Robert Czar. We've had Dr. Czar come speak at our annual mParks conference. And the idea behind it, for everybody listening, would be to actually get into your physician's offices and provide them with information about facilities and parks that are available that they could, quote unquote, prescribe to their patients. The trick to all this, as you know, is the step beyond it is wanting to get it actually embedded into an individual's health records, like a prescription. Okay, I'm going to prescribe 30 minutes a day, 3 days a week of walking on this trail at this park. And you're going to come back in 60 days and we're going to evaluate the outcome of that medication, just like you would a prescription for whatever is ailing you. And so that's been the hard part. The concept is beautiful. The concept is absolutely beautiful. The hard part is figuring out the technical side of integrating it into the health records and the tech end of it. So ParkRx America was providing some support during the beginning to help get into physician offices. That became a heavy lift. So then it became a little bit more on the locals to try and do that. So it's had some moderate success with certain communities here in the state of Michigan. But it's the concept is phenomenal. And like I said, there's information on our website about ParkRx America, some links and some things that folks could look at. But again, I'm never proclaimed to be the smartest guy in the room. So if someone knows how we can do this better and get it integrated into that system, we're all ears. But that's a super, super unique program that's has some real traction behind it if we can figure out the logistics and the tech side of some things.
Absolutely. And the reason that I wanted you to talk about that is because a number of professionals that are listening to this podcast are very aware of the ACSM's Exercises Medicine Initiative, which for all intents and purposes is the same type of programmatic design. It's a doctor prescribing a lifestyle intervention, physical activity, nutrition, stress management for some kind of chronic disease outcome. And the same barrier that you talked about there is the integration with the electronic medical records is the same barrier that we run into. And I think this is just another example of where there's potential synergy and collaboration between our two industries, because we are going towards the exact same place with what you're talking about. The one thing I do find interesting about this opportunity, and I'd just be curious for you to touch on it for a second. One of the benefits to a physical activity prescription in a park is that it's not dependent on disposable income and it's not socioeconomic status dependent. Can you speak to the importance of that for a moment?
Yeah, I think the accessibility to all is something that most of our park systems are obviously very proud of, and making sure that those public spaces have no barrier from a financial investment. They are supported through public tax dollars. They are supported through fundraising initiatives in order to keep those areas for our public free. And that's something that does separate parks as active gathering places for physical activity or mental wellness, or just the fun of a family reunion, which is mental wellness, is that they are accessible and they don't have a barrier of cost, so to speak. You're most likely paying for it in a way that maybe doesn't equate to I'm driving into the park and I've got to pay, $25 entrance fee to get in, or I've got to pay a monthly fee to get in. Although, our state parks have some of that type of revenue generation, but that is what makes a lot of us very proud of what we do, is we're offering something to community members that's at no charge at the point of entry. And that's definitely an accessibility thing that many of our park systems will tout. If you're looking for a place to go, and Mike, we saw it in the pandemic. I mean, the flood to the outdoors was almost overwhelming to our folks in the field because it was free. And you weren't necessarily restricted from being there. You could be there. So the non-traditional park user, somebody who hadn't used outdoor facilities, was coming into those areas because it was easily accessible and obtainable to get access. And so we saw in some cases, a 50% increase in usage in facilities because of the pandemic. And the challenge to that was a lot of it was happening. We were seeing the inverse of that was 50% reduction in staff that were there to handle the increase in usage, and the trash output and those things. So a lot of that is, we feel, because parks are accessible and free to the public.
And I think one thing that our industry doesn't consider enough, that being the health and fitness industry, is that accessibility element. And I think this is where there's another great opportunity for collaboration, is that we can't always get everyone into our health and fitness clubs. One, because some people can't afford it. Two, there are some people that can afford it that just don't feel comfortable in that kind of environment. They just don't feel it's an emotionally and psychologically safe space for them. And you've used the words live, work, and play during this podcast a couple of times. And I'm reminded of what my good friend, Dr. Tony Moreno from Eastern Michigan University, talks about, which is this concept of physical literacy and how adults going to the gym can look at it as recess, as play. I think that I agree with the concept. I think for some people it's a stretch, but I don't think it's a stretch to go to the park and do something that is play in nature. And I think that's where a unique opportunity exists here. But there are certainly barriers to collaboration. We talked about the first step, which is, hey, reaching out to your local Parks and Rec director and just having the conversation. What do you see as some of the barriers to effective collaboration between our respective industries?
Yeah, I think working through the liability, some of the things that, obviously, if you want to collaborate with local municipalities or government, they're very cautious to look at all aspects of the liability of what that collaboration or that partnership might look like. Some communities may be a little bit more conservative in that approach and say, no, we're doing fine. We don't need to increase ourselves to a certain amount of liability. Some may say, hey, we're already covered. Bring it on. Let's go. Let's do this. I think that would be something that would be an initial response out of the mouth of someone that is reached out to, is, well, we got to check into what that liability might look like. Or we haven't done this in the past, so we don't even have a form or a document that would outline what this agreement might look like, And so I think those are some of the barriers. They're easily overcome, but I think that's a standard canned answer from a lot of folks who haven't done the partnership model. So I think that's it. And then I think also, a lot of times, let's say you're to offer something in a park, and to get people there, it's free. It's offered for free, or it's offered as an incentive to do something. And sometimes I wonder, Mike, if people don't take that seriously, right? Well, that's not a program that I necessarily want. They're giving it away. How good can it be? So I don't ever say that there's not value to some sort of charge, not for entrance, but for program. And I think that's a barrier. Sometimes our folks will say, well, we don't want you to charge to run a program in our park, or we want a cut. We want 25% of your registration dollars. And you may say, that's not quite where we were thinking. So there's this back and forth, and there's some sort of shared service agreement that comes out of that conversation. But I think those are barriers. Again, to charge for service or not, the increased liability or not, those types of things would come in and creep into the initial conversations.
Good. And I just bring that up. And again, I don't think any of those are insurmountable by any stretch of the imagination, but it's good for people to know where some of the landmines could potentially be here. You mentioned liability, and I just want to touch on this briefly, because I actually don't think this is really on anybody's radar right now. Our industry during the pandemic would do exercise wherever they could, in parks, in their living rooms, on their balconies. We were trying to train people wherever we go. Talk for a second to the fitness and wellness professional that's out there that might be considering doing, workouts in parks with their clients, have it be an individual person or a group of people. What is the appropriate process to go through to make sure that that individual is covered properly, but also that they're relaying that to the local parks and rec department so they're covered properly?
Yeah, you definitely want to reach out before you do any of that. I think there's been this misconception that, public park, I can go in there and I can do whatever I want. And to a certain extent, from an individual user, yeah, you can go into a park and there's going to be certain rules and regulations you have to abide by. But if you're going to come in and show up and you're going to run a fitness class or a yoga class in a park, and you haven't let anybody know that, you're going to get questioned immediately, if that by a park suit, by somebody, to say, do you have a permit? Do you have, because that is the biggest fear, is that somebody gets hurt. And then both the county or the city becomes liable for that operation that's going on in the park, whether they knew about it or not, as well as the fitness entity or the instructor or whoever's doing that is going to be liable. And in this world of I get hurt, I sue, you want to make sure that both the property owner as well as the individual running the class or the program has the appropriate paperwork and liability insurance in place. That's just a no-brainer. It protects everybody involved. And it's just something that our folks will get a little cranky about if they just walk upon something happening that they didn't know about. And that then creates that negative between the two industries. That's the well, you think you can do whatever you want. Well, I can because this is public space. Well, no, let's just have an agreement of how this should look, and then we can do it. Mm-hmm. And I think that's the piece, Mike, that folks have to understand is be upfront, be open, be honest. And as an industry, we're very open to this. But the liability is scary, and there's a Recreational Use Act, and I don't know it well enough to speak super intelligently about it, but there is precedence out there on people using recreational properties and being injured and not having the appropriate liability insurance and things to use that property. And we can dig into that and see if there's some crossover there. But there is some it's called the Recreational Use Act on that. So that's a real concern and a real fear of many of our individuals, is people doing things in the park, getting injured, and them and not knowing or having the knowledge of what was going on, and then that's that negative press conference, right? Why didn't you know? Why were they there? None of us want to be put in that situation.
Yeah. And I bring that up not to diminish the opportunities for collaboration between our industry. I largely bring it up because I don't think people even know. I don't think it's within their awareness. And most of this stuff is very easy to resolve. It's a call to your insurance company, in many cases, just to add the municipality as additionally insured, which normally doesn't cost any money. And it's a conversation with the Park and Rec department about what you're doing. And if you are a little proactive in a process like this, which is going to take a little time and probably even less money, it can save you massive headaches down the line. And most importantly, like you said, help preserve the relationship between our respective industries. And I think that's more why I wanted to touch on this, to say, hey, this is a real thing, but with very, very little effort and energy on everyone's part, it is a non-issue.
Absolutely, 100%. And you hit it right on the head. It's calling your insurance company saying, here's a relationship we have. I want to add the county as an additional insured to my policy. They do that. We've done that. I've done that in the past with groups. It's a very simple process, and you're covered and everybody is happy.
Yeah, absolutely. Not challenging, but difficult if you don't do it up front.
Correct.
Your position allows you to interact with a number of people in the not only the park and rec ecosystem, but the public health ecosystem and just in government and politics in general. We're at a tough time in this country with the pandemic, certainly, and the health of our population is not where we would like it to be, to say the least. What gives you hope, though, for the health of our communities?
That's a great question, and I think it's seeing the resiliency and the passion that people have that are working in this field, in this industry, to step it up, to one up it, to say we're not going to push our chips in and say we just can't do this because we don't have enough workforce to do it, or we don't have enough resources to do it, or money. Our folks are scratching and scraping and looking for grant funds, either at the state or the federal level, to say, no, we need to continue to build capacity to do this work. We've had long conversations in many of our committee meetings. mParks has a number of different committees that focus on certain areas of the industry. Our public policy committee really has been adamant on legislation, as you well know, in the work that you've been doing and with the Fitness Association and all those things. It's seeing that folks haven't said, I give, right? This is important work. Our health of our society needs us, whether they recognize that or not, they do. And so looking at it from the members that I run into who are running community centers or running park systems, they're looking for ways to be creative and ways to collaborate. And that gives me hope, because it can be very easy for people to say, forget it. Like, I'm going to run my leagues. We're going to do status quo. And this is what's going to get us through. And when the time comes that, things have changed, we'll ramp back up. But people, for the most part, in our agency memberships haven't done that. They've continued to try and offer things even through the pandemic and keep folks active. And it does give me hope. I mean, it's a pretty passionate group. When we come together as an association, or we bring folks in from the outside to an event that we're hosting, we brought some outside folks to our board retreat back in August, and they couldn't believe the synergy that our folks that were at that retreat had. And these are business folks who, from ITC and some other areas in the Michigan Department of Health and Human Services, which are on our board. And they're like, wow, you're a passionate bunch. Like, you all really take your jobs seriously. And that's always been a reason why I've wanted to stay involved. And why I wanted to lead the association is because people don't give up, and they'll jump on when it's time to go. And kind of that grassroots advocacy is pretty powerful.
Yeah, that resiliency should resonate with a number of our listeners, because our industry has embodied that same resiliency during all this. It's been very easy for your constituents, mine and my industry, to just close up shop, but we're passionate about making people healthier.
Yep.
Where can people go to find out more about you, mParks? Where's a good place to go?
Yeah, so our website would be a great place to start. It's www.m, as in Michael, parks.org. Great starting place. There's all kinds of information there. And clickable click-throughs to find, about information, to find out. We have got a programs and initiatives tab that if you click on that, it pulls down and it will talk about some of the health initiatives that we've embarked on, and you can kind of scroll over and click and choose some different things. We've had, a lot of success with some of our partners just kind of investigating our website, and then, reaching back out to me to clarify different things. Certainly, anybody, Mike, you'd be welcome to share my email. It's just csummers@mparks.org. Be willing to have one-on-one conversations. Certainly, you've talked with my public policy committee and our board. I've spoken to yours. There's an open line of communication. But if you want to dig into your community, You certainly could get a hold of me and we can connect you, or you certainly could, kind of just search that on your own and find out who those folks are.
Yeah, that's great. And we'll link up to the mParks website in the show notes page. And for those of you that are listeners that aren't in the state of Michigan, I know we have a number of our listeners that are from around the country and probably even some internationally. There are your local parks and rec departments that you can go to. Google is a great resource for that. And as Clay said earlier, just make the reach out.
I would make the comment too that there are parks and rec associations in all of our states across the country for those that aren't in the state. And if you're listening from Colorado, there's the Colorado Parks and Recreation Association.
Yeah.
Allison Kincaid, I know her very well. She would be me. There's a way to link up. There's a way to have the conversation with your state association. They're all over the country. And certainly I speak to those folks on a monthly basis. We have a standing call and we talk about what's going on in our state, and wellness and health, and all these things are always on the agenda. What are you doing to better equip our members to play in this space and to be leaders in this space and to collaborate in this space? So we're all in this. And then there's a national organization that I've mentioned to you before that kind of is our parent, called the National Recreational Park Association.
Awesome. And yeah, we'll also put a link to them in the show notes.
Okay.
Well, Clay, before I let you go, I'm actually very intrigued to get your answer to this question, because you aren't my typical guest on the podcast. Normally, I'm bringing people in from the allied health field to have these conversations, and they have a very much an insider's perspective. You're going to bring an outsider's perspective, which I think is incredibly valuable. And this concept and question is around the wellness paradox. And for me, the wellness paradox is the gap that exists between fitness and wellness professionals and the medical community. There's a trust gap, an interaction gap, a communication gap. We've got a bunch of fitness and wellness professionals listening. If you could give our group of professionals one piece of advice on how you think we can close off that very important gap, what would that piece of advice be?
Tell our story. I mean, advocate and tell our story. And I think that resonates with me. I don't feel like sometimes we spend enough time talking to folks and telling our story. So when you look at healthcare providers and you look at, the Blues, and you look at all the folks that are out there in that world, it's making that connection and talking about what we do to increase the health of our communities and how we save our communities money by providing health and wellness. We're getting better. I wouldn't say we're anywhere close to being good at it. But that's the biggest thing. Do not put off a story that would resonate with folks. Look at your legislators. Who's representing you at the state level and at the federal level? Who's representing you? Tell your story to those folks. That's how you build trust, and that's how you build advocacy. So that when the next round of funding or bills come up that might affect our industry or our business, they know who you are and they can reach out. And that's only through storytelling, right? And making sure that that's a packaged, consistent message. And so I think as industry partners, we could create that specific, again, they're not going to be the exact same message, but they certainly could intertwine. Mm-hmm. And so I guess I would tell folks that, to me, that would be the most important thing is creating that message or that story, believing it, and communicating it in an effective way to those that need to hear it.
Outstanding. Clay Summers, thank you so much for joining us on the Wellness Paradox.
It's been a pleasure. I appreciate the time, and always willing to chat about things we're passionate about. So thanks, Mike.
Well, I hope you enjoyed that conversation with Clay as much as I did. If you found it insightful and informative, please share with your friends and colleagues. Any information we'd like to share from this episode can be found on the show notes page by going to wellnessparadoxpod.com/episode 31. Please be on the lookout for next week's episode when it drops on Wednesday. And if you have a moment, please leave us a review on your favorite podcast platform. Those reviews make a massive, massive difference for us. Until we chat again, please be well.